Hi everyone, welcome back to the fourth video of this week lecture. In this video, we're gonna discuss on the pharmacodynamic interaction and other drug interactions such as drug-food interaction and drug-herb interactions. In the pharmacodynamic interaction, I will emphasize more on these two factors, which is the antagonistic interaction as well as additive or synergistic interactions. It is because you will learn more in depth in the Dr. Stephen Lin Xiongmeng lecture later on. So, in the antagonistic interactions, drug that has agonist actions occupy these receptors and activate them to exert the therapeutic actions. Meanwhile, antagonistic drug is a drug that occupy these receptors but do not activate them, which later do not produce any therapeutic effects. If the agonist and antagonist drug are given together, the antagonist may block receptors activation by the agonist, which cause less activation. As example, salbutamol is an agonist drug at the beta adrenal receptors. So propranolol is the antagonist drug of these receptors too. So what happened if this propranolol will reduce the therapeutic effect of the salbutamol by blocking the beta adrenal receptors. For the additive and synergistic interaction, if two drugs with similar pharmacological effects are given together, the effect can be either additive or synergistic. As example, ACE inhibitor and potassium sparing diuretics are the antihypertensive drugs that have their own pathway. When we given together, they can produce the synergistic effects. However, the mechanism frequently will contribute to adverse drug reactions. So when these two drugs are given together, it will increase the risk of hyperkalemia. So let's have a brief discussion on the drug-food interactions. So it will affect the absorption because of food can cause clinically important changes in drug absorption through effect on GI absorption or GI motility. Example of drug that should not be taken with food, such as iron tablets as well as the antibiotics. That's why you should consult the patients who are on antibiotics should taken in empty stomachs or before food. Besides that, the drug-food interaction also can affect in terms of metabolism, especially grapefruit juice. It is because grapefruit juice contains naringin or bergamottin, which is the intestinal cytochrome 3A4 inhibitors. So, to those who are being administered, the drugs being administered intravenously are not much affected, but it can be affected to those drugs be given orally. So this grapefruit juice can inhibit the P-glycoprotein and organic anionic transporter, which is the drug transporter protein. Once it's blocked this transporter, it will cause little drugs in the body. Meanwhile, at the same time, it also can block the enzymes such as cytochrome 3A4. It will affect the philodopin drugs, which will cause too much of philodopin drugs in the body. As a future pharmacist in Malaysia, you should aware about the drug-herb interactions. Yes, Malaysians like to take herbs as a part of their additional treatment for their illnesses. So please bear in mind, ginseng can interact with the warfarin, which can decrease or can cause no effect on warfarin efficacy. Aside from that, ginkgo biloba is another popular supplements or popular herbs that be taken by Malaysian citizens. It cannot be taken with the aspirin, which will associated with bleeding if they taken together. Green tea also can cause some drug-herb interaction, especially the nadolol, which is the beta blocker. So this green tea will decrease the exposure to the beta blocker nadolol, which later will affect the blood pressure control. So there's a lot of drug-herb interactions that you can find in various resources such as you can refer to the Stokely drug interaction, Lexicon, Medscape, up-to-date, and also the most common popular one is the Micromedics drug interactions.